What should someone consider when choosing between formula and breastfeeding?
Breast milk is the absolute perfect food for human babies. So if at all possible, breastfeed. Breastfeeding is clearly better for growth, for intelligence, for allergies, for just about anything you can name, including maternal-infant bonding. It's a wonderful experience. It's an optimal food for humans. If for some reason you can't breastfeed, formula is a great option. We have humanized cow's milk to create formula. We've taken the milk from cows and we've done our very best to create a liquid nutrition which is almost the same as human breast milk, but it's cow's milk. So we've tried to align the amino acids, the vitamins, the fat content, etc., to make something that's close to human milk but isn't human milk. So I would recommend that every mother work at breastfeeding. It's worth the effort early on to start the breastfeeding process. Give it a good go. It'll probably work with some support. You'll get over the hump. You'll be able to breastfeed, and it's optimal nutrition for humans. However, if that doesn't work out for a variety of reasons, whether they be biological, personal, or social, formula is just fine.
What vaccinations should a new parent expect during their baby's first year?
Immunizations are really important for the health and well-being of children, individually and population-wise. Parents can expect their pediatrician to offer a large number of vaccines during the first 2 years of life, with more occurring in the first 12 months than any other time of life. These vaccines will include hepatitis, diphtheria, tetanus, pertussis, polio, Haemophilus influenza, strep pneumoniae, rotavirus vaccine, measles, mumps, rubella, chickenpox, hepatitis A, as well as influenza. So there are a lot of vaccines, and each of them will be discussed along the way in the medical home context.
What is the normal body temperature for a baby?
Body temperature varies among all of us, babies, children, and adults alike. Humans are not machines. There's not one set point that's always the same. So if you happen to measure your child's temperature at various times during the day, you'll notice that it fluctuates. Babies should have a body temperature that is below 100.4 taken rectally. Now, it's important that you take the temperature rectally because that's the most accurate temperature, and babies don't mind having a rectal temperature taken. Temperatures taken under the arms are generally too low, and babies can't take a temperature in their mouth. So a rectal temperature under 100.4 is normal. So it can be 98.6, 99.6, 100.1. Any of those numbers are fine, and you will find that they vary throughout the day. However, if you do find a temperature above 100.4 and the child is less than 2 months of age, you should call your pediatrician immediately.
What do you recommend for babies under 1? Tylenol, aspirin, or ibuprofen?
Aspirin is never recommended for children anymore. It's an archaic remedy that was used when I was a child, and in today's world, the 21st century, aspirin has no place in parental medication of children. There are indications for aspirin when a doctor specifically recommends it, but that's not for the routine management of temperature elevation or pain in a child. That leaves you with either acetaminophen, which is brand name Tylenol, or Ibuprofen, which is Advil or Motrin. Those are both very good for the treatment of temperature elevation, fever, or pain. However, Motrin is not approved for use in children under 6 months of age. So over the age of 6 months, either Tylenol or Motrin or Advil is fine. There's no difference in the potency and the efficacy of these drugs. However, it's very important to pay attention to the optimal dosing. It's dosed based upon weight, and the dose for a child with Tylenol is 15 milligrams per kilogram. With Advil or Motrin, it's 10 milligrams per kilogram. So Advil is somewhat more potent, but no more efficacious. You just have to use the appropriate number of milligrams of Tylenol or acetaminophen.
What developmental milestones should I expect my baby's first year?
Babies are wonderful. They come out somewhat inert and looking around and not doing much motor-wise or vocally. And during the course of the first year, you're going to see remarkable exponential growth in their development. Your pediatrician should monitor development at all well-child visits, which typically occur at 2, 4, 6, 9, and 12 months of age. During these visits, your pediatrician may ask you questions or examine your child in the area of gross motor development, fine motor development, language development as well as social development. So you will, if you think of those 4 streams, gross motor, fine motor, linguistic, and social, you can see changes in each one of them every week as your child develops. So I won't go through each and every developmental milestone, but you know a baby lays on their back and doesn't roll over, and by 3 to 4 months they're rolling over, and by 6 months or so they're crawling, and by 9 months they're pulling to a stand, and by 12 months they're starting to take steps. Now those are generic numbers because every child is different, and so you wouldn't want to get too concerned if the book says my child should walk at 12 months of age and your child walks at 10, that's fine. If he walks at 15, that's fine too. So your pediatrician is a very good guide for understanding the variability of development and what's normal and what's not normal. You'll also see a lot of development in the language area, which is really critically important, that you talk to your child, you read to your child, and infant, even under 1 year of age, so that they develop language and not only receptive, which is understanding what you say, but expressive, which will occur more visibly at about 1 year of age. If you look, for example, at the social development, babies generally do not smile or relate socially in the first weeks of life. But by 6 to 8 weeks, babies are looking and smiling, and as they progress over the first 4 months of life, there is a very interactive social smile when a human face, especially the mother or father's face, is placed before them, moving on into laughing and interacting by playing patty cake or waving. Those are all social milestones. In the linguistic area, you'll notice that babies do very little linguistically other than cry in the first weeks of life. However, they soon begin to coo and have open vowel sounds such as ah, oo, and by 5 months of age, you'll hear consonants being added, so they'll say ah, goo, ga, and you'll start to hear the development of language with more complex sounds, and by the time a baby is between 6 and 9 months of age, you'll begin to hear conversational babble, so that you can say to your baby, "Aren't you a beautiful baby?" And the baby will look at you and say, "Aga baga boo boo," which is, "I am a beautiful baby," but they're not saying that with words. Of course, by 12 months of age, they may use actual words such as mama, dada, with meaning. In the fine motor area, you'll notice that babies in the first weeks of life move their extremities a little bit, but don't use their hands very adeptly. By 4 months of age, babies are waving their arms and looking at their hands and somehow recognizing that my brain is connected to these things, but I don't have full control of them yet. By 6 months of age, babies are reaching for objects, taking objects, and as they progress through 9 months of age, you'll start to see the development of a thumb and finger pincer grasp, an overhand grasp, and even shaping for objects. So if you were to hold a toy out in front of a child at 6 months of age, they might grab it this way, but by 9 months of age, they might shape their hand in anticipation of picking up the object. In the gross motor realm, a baby at birth will basically lie on their back or their stomach, however they're lying, but they won't move from that position. Ultimately, they'll be rolling over between 3 and 4 months of age. They'll be crawling around 6 months of age. They'll be pulling to a stand at around 9 months of age and usually letting go and taking steps by 12 months of age.
When will my baby start teething, and how can I help ease the pain?
Teething is an interesting process which precedes the eruption of teeth. So teeth usually erupt by around 6 months, although the actual month is quite variable. Babies will begin drooling, mouthing objects, perhaps becoming irritable or having a runny nose or a little diarrhea in association with teething. This syndrome of putting objects in the mouth and being irritable and drooling, we call teething. Now, this does precede the eruption of teeth, is not the time when the teeth erupt. Now, when babies teeth, they may have all these symptoms that I mentioned, but they are never truly ill. In other words, if a baby has a temperature, that is not due to teething. Anything above, let's say, 101 is definitely not teething. Perhaps teething can give you a 100.5, 100.8, but never 101 or above. So teething is not a disease. It's not something that can be characterized by temperature elevation. If babies are irritable and teething, you can try using something hard like a teething ring that can go in the freezer that they can mouth. They can mouth a binky. Some children will just chew on their hands or anything else that you put in their mouth. And if they're truly irritable with teething, I'd recommend that you give an appropriate dose of Tylenol.
What about vitamins? Do babies need vitamins too?
Depending on their age and what they're being fed, many babies could use a vitamin. Formula-fed babies do not need to take a vitamin until they're 6 months of age, and even then they don't need a multiple vitamin. At 6 months of age, in Nassau County, Long Island, where the water is not fluoridated, your pediatrician will provide a prescription for fluoride. So the formula itself has plenty of vitamins in it, and they don't need any other vitamins, but they will need fluoride at 6 months of age. And that goes true for breastfed children as well with regards to fluoride. However, if you breastfeed, in this climate and culture, we recommend that children take vitamins A, D, and C along with breast milk because we may be physiologically insufficient with those vitamins in Nassau County in 2011. And that has to do with, in part, the fact that we wear a good deal of clothing and our body's not exposed to the sun, thus creating the sunshine vitamin, vitamin D, in our skin while we're standing breastfeeding outside in the sun. That just doesn't happen in our current culture and environment, so therefore breastfed babies are given A, D, and C. When a child reaches 1 year of age, the pediatrician will generally change the vitamin for every child to a multiple vitamin with fluoride in this county.
When do babies begin to sleep through the night?
That's quite variable. Babies waken for nocturnal feedings during the first 4 months of life routinely. Somewhere between 4 and 6 months of life, you'll find longer periods of sleep, and we should be seizing those opportunities to give up on the nighttime feeding between 4 and 6 months of age. After 6 months of age, infants generally do not need to be fed unless there are special circumstances at night. So sleeping through the night is a product of normal physiologic and neurologic development, as well as appropriate sleep hygiene administered by the family. For example, if the child learns to fall asleep in the parent's arms and be rocked to sleep or breastfed to sleep, it will be much more difficult for children to self-comfort and sleep through the night when they awaken at even 6 or 9 or 12 months of age. However, if normal and appropriate sleep hygiene is applied and the children learn to self-comfort and go to sleep on their own, they'll be less likely to demand parental attention in the middle of the night after 6 months of age.
Is it okay to put a baby to sleep with a bottle?
We prefer that babies feed, be done with feeding, and then go to sleep without being fed. As I was talking about sleep hygiene, we want babies to learn to self-comfort. And if they fall asleep either at the breast or with a bottle in their mouth, when they routinely awaken in the middle of the night, as all babies do, they may ask to be fed in the middle of the night when in fact they don't need to be fed. So it's not a great idea to put your baby to sleep while feeding, just as you would feed and then stop feeding and carry on doing something else, and you would not fall asleep feeding. Same thing for babies. Feed them and then place them down and let them fall asleep.
What about the use of pacifiers? Is that recommended?
Every baby has different sucking needs. Babies suck for nutrition because they're programmed to suck on a bottle or a breast in order to attain nutrition. Some babies have what we call non-nutritive sucking needs. That means that they just like to suck more and they don't necessarily need the nutrition associated with sucking. Some babies will find their own thumb to suck or the back of their wrist to suck. If that is comforting, that's fine. Therefore, a pacifier is not a problem for a baby. Babies can use a pacifier for comforting or non-nutritive sucking needs for the first year of life, clearly. In the second year of life, it would be nice if the pacifier use diminished, and certainly by the third year of life, it would be good to get rid of the pacifier altogether. It will not cause orthodontic problems when used in a newborn baby or up to about 18-20 months. If a baby or a toddler gets stuck on using the pacifier all the time and they're greater than 3 years of age, then they will tend to create an overbite and a high arched palate. So the pacifier in infancy is not a problem. The pacifier in toddlerhood can be.
Where can I go to find more information about this topic?
You can get more information online at aap.org. That's the American Academy of Pediatrics website for authoritative information. And Winthrop University Hospital at 1-866-WINTHROP or winthrop.org also will provide great information.